In recent years, the rates of young children accidentally ingesting illicit substances has been on the rise. This is in part due to an increased opioid use and a broadening of states permitting legal cannabis. But the troubling trend is also impacting young children. So Julie is standing by now with safety questions in today's Ask a Doctor.
Ask a Doctor is sponsored by Red Mountain Weight Loss.
According to Orlando Health, some of these cases where a child ingested an illicit substance happened in a public place. Joining us now, Dr. Jenna Wheeler, pediatric critical care physician at Orlando Health Arnold Palmer Hospital. Thank you so much for being here this morning.
Thanks for having me.
And this is something you mentioned, a public place. This is something that, as a parent, I really hadn't even thought of. How big of a problem is this?
You know, we see it pop up and kind of more and more lately from, people staying in Airbnbs, hotels, even a changing table at a local shopping area where kids are getting exposed to drugs that parents have no idea could even be possible.
A changing table, that is terrifying to think of. So as parents, what do we need to be thinking about when we are in these public places, especially with little kids?
You know, the biggest thing is just to kind of observe your surroundings. Is it an area that looks clean? Do you have availability to wipe it down before? That's kind of the biggest thing is, especially with the changing tables, substances are getting left behind on those tables that we wouldn't want our children exposed to. So being able to wipe them down, a lot of times being able to carry one of those little pads with you to put your baby on top of, and really being able to watch your child and making sure they're not grabbing things, or if you see them, grab something, really take a close look at what it is.
So what types of substances are left on changing tables? Are we talking about like fentanyl? Like what are we talking about there?
In this case, it was fentanyl, where, unfortunately people, based on the height of the changing tables and such, are using them for things that we would never consider. And then you go and lay the baby down and they're able to come in contact with that substance.
And we mentioned with the legalization of medical marijuana in a lot of places, are you seeing issues with children maybe ingesting edibles and things like that?
We are, and when I alluded to, hotels, Airbnbs, we had one where a whole family of children, they found something that hadn't been cleaned out of the place that they were staying, and we had, I believe it was 5 children come in, all with ingestions.
And, a lot of people may not realize that some of these packages do kind of look like candy. So what do parents need to be aware of with this?
A lot of it, when kids get old enough, educating kids. I have a teenager, and so make sure you really look at whatever you're taking. And for the younger kids, just have parents, if kids come to you and say, oh, can I have this? Take an extra pause to really look, because as you said, the labeling is the same. It's very slight differences in the lettering, the coloring. So just really making sure that you know what kids are getting into.
And so many little kids just get into everything. So even if we're talking about, something that's been prescribed for you or another member of your family, is that an issue as well sometimes?
It is. And, especially this time of year with school being out, just having a holiday, we take our kids to other people's homes, whether it be family, friends. We don't always know, what's in their medicine cabinet, or, some people, especially if they don't have children, they don't need to store their medicine up the way people with kids do. So just kind of really being aware of the surroundings. If you know someone's on specific medications, just saying, hey, if I'm bringing the kids over, would you mind putting those up? And just being a little bit more aware.
Yeah, so as parents, what are those safety tips that we need to take with our own medications and things we might have around the house?
One of the big things is knowing your children. Some kids are more apt to get into things than others, but always having medication up in an area that kids aren't able to reach by either climbing. A lot of times they have little lock boxes, making sure that we have the safety caps. It's, you're using medication every day. Some people leave them not quite on because it's easier. But making sure those safety caps are really in place, and making sure, that when you go over to other relatives' homes and things, that maybe you help grandma with those same safety tips.
Those safety caps, man, those can be hard to get off.
They can, but they really do. They really do serve a good purpose.
Right. So how concerning is all of this as we continue to move forward with all these, like you mentioned, the changing tables? I mean, this just seems something like I'd never thought of with like an older child, but this is really concerning.
It is. It's shocking, and for the family that went through this, and you're just changing your baby. You're doing a basic thing. And so I think it's just all having that awareness. And even if you don't have a little child, if changing tables aren't something you're using, just paying attention when you're in places. There's always phone numbers to call if they need cleaning or attention. So if you're seeing something, everyone just kind of look out for each other.
Wonderful. Well, thank you so much. We appreciate you being here.
Thanks for having me.